it seems inevitable that a fourth wave will strike Ontario this fall. While some people may be feeling anxious about it, medical experts say it likely won't be as bad as previous waves, and with the right actions, the damage could be minimal.
We've been walking a fine line, or a tightrope, keeping in business. And if something happens that's going to shut us down again, we have no idea as a business what really is going to happen.
The co-owner of Port Credit Academy of Martial Arts is concerned about the upcoming fourth wave. Christopher Doyle is double vaccinated. Everyone working for him is as well.
We do everything we can, obviously, inside the facility now that we're back in live classes to keep everybody safe.
Walk into many clinics and get your first dose.
Public health and preventative medicine physician Dr. Barry Pecos says even though 80% of Ontarians 12 and older have received at least one dose, it isn't sufficient to stop a fourth wave from happening.
Unfortunately for the Delta variant, that is simply not enough. It is nowhere near enough. We need to get at least 10% higher, if not more than that, in order to prevent a significant fourth wave. A small one that doesn't involve lots of deaths and hospitalizations, that's what we're looking forward to, and hopefully what we're going to see, nothing more than that.
Going into the fall, I think I'm ready for anything that's coming. I'm careful, I'm vaccinated.
Is there a message of hope, of optimism for people who are feeling very anxious about the fourth wave?
Oh, for sure. I don't think we need to worry. If you're vaccinated, I think you need to worry a lot less. How it affects our society is a different question. So, we still do have 2.5 million Ontarians who are eligible who don't have the vaccine. And that is enough people to spread it amongst themselves and to fill it in hospitals. Maybe you don't get COVID, but if hospitals do have a significant number of COVID patients, then we might see an inability to meet some of the other healthcare needs.
Earlier this week, the Ontario COVID-19 Science Advisory Table released a report recommending schools remain open for in-person learning unless there are catastrophic circumstances. The detailed report found that there is overwhelming evidence that shutting down schools has a substantial impact on children's physical and mental health. It also has serious effects on the mental health of parents. Some feel regardless of an uptick in cases, the province should remain open as well.
I don't think there'll be another lockdown. I think Ontario had it with the lockdowns.
Dr. Pecos says at this point in the pandemic, there are more examples to learn from and hopefully avoid repeating past mistakes.
We can see how other jurisdictions are dealing with it. The United States is in a different position. The UK is in a different position. Countries like Israel, France. And so we can look at them and say, we don't want to go in that direction. Let's everyone get vaccinated and prepare for it, and hopefully we can avoid another lockdown.
Dr. Pecos says if we want to see a healthy fall, those who aren't vaccinated should get their first dose within 2 or 3 weeks so they can get their second dose 3 or 4 weeks following that before the official start to fall.